Great. Good afternoon. My name is Hannah Mori. I'll be your moderator today. Welcome to today's call, Inequality in the Era of COVID-19, a discussion with U.S. Senator Cory Booker and New Jersey civil rights advocates Amal Sinha, Executive Director of the American Civil Liberties Union of New Jersey, and Ryan Haygood, President of the New Jersey Institute for Social Justice. A note to our viewers, the speakers today will be answering your questions later in the program. To submit a question, please type that question into the Q&A box at the bottom of your screen or leave a comment if you're streaming live on Facebook. And with that, Senator Booker, the floor is yours.
I'm really grateful, everybody. It's just good to be on and good to be on with some other leaders who I have not only a great deal of respect for, but really lean on in terms of helping to deal with some of the important and pressing issues that we have, like the one we're talking about today. I want to just thank Amal and Ryan for making the time, and again, for just being such extraordinary activists and leaders for change. So this is like a time, I think, for many of us where we're facing the challenge of a pandemic, the crisis, the challenge for us in our own lives. But one of my biggest hopes for this period is that we begin to see, with all the revelation of the fragility and inequalities and falling short within our society, that we see a time where we can expand our circles of empathy for each other and really begin to have a better moral imagination for who we are and who we can be. This crisis is really like pulling back the curtains. This COVID virus is really feasting upon our society's vulnerabilities, feasting upon our society's weaknesses. And when it comes to racial disparities and how this virus is manifesting itself, it's feeding upon so many of those disparities that have been in our society for a very, very long time. I was mayor of the city of Newark during the recession and saw how the recession really was a Great Depression for many areas of our country. And in fact, when it comes to racial disparities in wealth, we saw that there were decades, literally, of Blacks and whites slowly closing the racial wealth gap. But then when the recession came in, it basically wiped out, by disproportionately affecting communities of color, basically wiped out generations worth of gains in that area. And the recovery after the Great Recession has been so much slower for communities of color. Well, this is a time where we're seeing that as well, but unfortunately, we're seeing it compounded by a lot of other challenges that this virus is bringing forward. And again, a lot of other disparities. And so some of the disparities are there in the world of health that have made African Americans so much more significantly affected directly with higher death rates in this disease. And we've seen tremendous disparities before COVID-19. For example, we are already the worst country in the developed world for maternal mortality, but Black women are 3 to 4 times more likely to die in childbirth than white women. For asthma, a Black child is about 10 times more likely to die from asthma complications than a white child, and asthma rates are so much higher in the African American community and in urban communities like the one I'm sitting in right now. The pandemic, again, is just underscoring the fact that we live in a society marked by these deep divisions along racial lines. One of the first bills I introduced in my career as a senator was a commission to comprehensively study the racial health disparities, because we as a society need the conviction to act and the data to understand the problem and actually fix it. I'm grateful to Governor Murphy for his leadership in the state for mandating this data collection at this time of this virus. And I'm glad that Senator Schumer has made this a priority for the caucus. I led the call in the Senate to get the CDC and others to be collecting the health data so we can better attune our strategies to deal with these racial disparities. I've called on the Trump administration and introduced a bill to ensure that that reliable, uniform racial data is collected, measuring the impact of COVID-19 on low-income communities and on minority communities. Because again, the data we do know is startling. So for example, in Louisiana, 70% of those who have died from COVID-19 are Black, compared with 32%, with Blacks being only 32% of the state's population. The initial data from Boston shows that among people whose race was reported, more than 40% of the people who are infected are African American, compared with only being 25% of the population. If we're going to fix these issues, if we're going to address them, we've got to make sure that we have the data collection. But something else we can do right now, as so many Americans are losing their health insurance, their employer-based health insurance, is to open up a special enrollment period for the Affordable Care Act. Will go a far way in addressing communities that are in desperate need for health coverage. And initial data that we see, we project with millions and millions more falling into millions more falling into unemployment, that just opening up the enrollment period could help millions of American families right away. People with pre-existing conditions we know are more vulnerable and less likely to be insured, and we know that they're more susceptible to the coronavirus, so it's got to be part of our strategy. We also live in a nation where there are deep-seated injustices beyond just health. It's other areas like the wealth inequalities. Many of you know that there are numerous reports of emergency funding in our PPP program not going to mom and pop businesses, but going to those especially low-income communities. We've seen people that were better positioned, connections to banks, being able to get PPP, while a lot of folks have been left out that didn't have the banking relationships. And that's particularly seen in communities of color. It's one of the reasons why I fought so hard to make sure that we had a $60 billion set aside for community development finance institutions, for minority development institutions in the latest funding package. It's critical that we get this money to financial institutions that actually have connections to communities of color, to minority businesses and more. To expand on this effort, I've introduced another bipartisan bill for a proposal to put about $50 billion into small business relief, local relief funds, which will have a much more equitable distribution of resources. In addition to that, larger policies as we look to the future, like baby bonds legislation that would give every child born in America $1,000 in a savings account. And then every year, depending upon their income, make deposits into that up to $2,000. This is another bill that would go to empowering low-income Americans overall and also go a long way to healing the racial wealth gap. Another area that we're fighting really hard on is just the mass incarceration that we see in America. And we know that this war on drugs has not been a war on drugs, it's been a war on people, particularly people of color, low-income people, and other vulnerable populations. In the time of COVID, it becomes even more urgent that we do something about this mass incarceration. We know that Black men are 6 times as likely as white men to be incarcerated. Hispanic and Latino men are about 2 times as likely. We know there's no difference in using drugs or dealing drugs, but African Americans are 3 to 4 times more likely to be arrested. And so we have been aggressively engaged in my office during this time of COVID to really push for the release of people from prison, pushing to stop people from going in for things like technical parole violations, really an agenda to depopulate our prisons and jails during this time, especially this time that prisons and jails are becoming hotspots. I know that the ACLU of New Jersey is doing important work advocating for the safety of people in our prisons and detainees in our ICE facilities in New Jersey. I'm thankful for their leadership. I've reached out to BOP and ICE to do a much more aggressive job on releasing those folks who pose no threat to our society whatsoever, but can begin to depopulate those prisons, jails, and immigration detention facilities and encourage safety. This is a time that demands activism and demands leadership. This crisis is a time not for us to long to go back to normal, but to double down on committing ourselves to creating a new normal, to expanding that moral imagination, to know that we can create a better society that doesn't just pat workers on the back and call them essential, but actually invests in them and makes a commitment to things like healthcare and paid family leave and a living wage. This is the time that we as a society must create that more beloved community. We've seen that how out of darkness in the past, whether it's the bombing in Birmingham that killed 4 girls in a church, or even the shirtwaist factory fire, often out of tragedies, we emerge more committed to each other and more of a sense of urgency to create a more just nation. This has got to be one of those times. And so I'm really grateful for the ACLU of New Jersey and New Jersey Institute of Social Justice. Grateful to be working with them as we fight on this next big relief package in Washington. And I'm looking forward to the rest of this forum today. Thank you very much.
Thanks so much, Senator. It's good to see your face and to hear your voice. And I hope everybody that's watching at home or wherever they are is doing well and staying healthy. Senator, you hit the nail on the head when you talked about the disparities. This is a situation where we're seeing the fissures of society that have existed across every institution, across every agency, come to the surface and be exacerbated. And oftentimes those fissures revolve around issues of race and identity. I'm here to talk about the stuff that we're doing in the criminal justice and immigration justice space, but I want to take a minute to acknowledge the fact that Black and brown people and communities are going to be impacted and are being impacted in disparate ways across the COVID-19 pandemic. And what we know at the ACLU and my partner here at the Institute of Social Justice, Ryan, knows is that COVID-19 and the response to it is a racial justice issue. We are seeing Black and brown people facing the healthcare burdens, the economic burdens, the social burdens, the educational inequities. They're dying at a faster rate. They are overrepresented in the criminal justice system, and therefore they're suffering there. They are the frontline workers, the grocery store clerks, the people in the healthcare industry that are saving lives. And we need to make sure that the future looks more just and more equitable. So let me talk a little bit about the work that we're doing in prisons. So the ACLU in this moment is trying to make sure that the most vulnerable among us, including those who are incarcerated right now, are not devastated because of this pandemic. And we know that prisons and jails and those confined spaces are dangerous places for viruses and the spread of disease, even in the best of times. Healthcare is often inadequate, and prisons weren't designed with social distancing in mind. They were designed to hold people in close quarters. And so what we're doing at the ACLU, based on science, based on data, and based on public health expertise, is calling for the safe release of as many people as possible to either temporary release or commutation of sentences. What we need to see is a dramatic reduction in prison and jail populations across the country, because otherwise we know that the virus is going to continue to rage on. And it doesn't just affect the lives of those who are incarcerated. It obviously touches those who work in prisons and jails as well. We're thinking about corrections staff and nurses. Look, in New Jersey here, we have a prison population of about 18,000. And what we've learned in this pandemic is that New Jersey has the highest rate of death in the country during this pandemic in its prisons. We're second in raw numbers only to Michigan, which has double the overall rate, double the overall number of people who are incarcerated in their state than New Jersey. So we've seen, 38 souls die in New Jersey prisons because of this pandemic. And that's just unacceptable. We want to make sure that people are taking precautions, that our leaders are making a choice here to release as many people as possible, and that we do it as fast as possible, because every single day counts. and every day matters. Every day we're hearing reports of more and more people being infected and more people dying, and that's just unacceptable. The ACLU of New Jersey, we've filed several pieces of litigation on the premise that we need to release as many people as possible. We filed over a dozen representing people who in immigration detention. We've been relatively successful in trying to get individuals out of immigration detention right now. And as folks might know, in New Jersey, we have county jails that host immigrant detainees for ICE, and we have a private facility that does the same, and that adds up to thousands of people that are incarcerated on civil immigration violations in New Jersey. And we filed a piece of litigation to get people out of county jails that resulted in a consent order that allowed for the release of 700 people from county jails across the state. And we're filing litigation regarding the people in state prisons as well. And we put on some political pressure and some advocacy, got over 700 New Jerseyans to write emails to Governor Murphy, and did a lot of social justice organizing online to get the governor to issue an executive order that called for the release of certain populations of people who are incarcerated. Of course, we're targeting those who are medically vulnerable and elderly right now because we know they're most at risk. However, even though the governor signed an order that allows for the release of significant amounts of people, it allows for the release of close to 2,000 people, I believe, only about 70 to 80 have been released so far, and it's been almost a month since that order was signed. And we need to see our state do more, our Department of Corrections do more as fast as possible. Otherwise, we're going to see more people die. And what we know about this moment is that people who are dying, a lot of those deaths were preventable. If we had taken precautions and allowed people to self-isolate properly and go to a place where they can be safe and get healthcare, some of those folks could still be alive with us today. And that's just unacceptable. And we need to, collectively do more here. We need to urge the governor. We need to urge the Department of Corrections. We appreciate the intentions behind the executive order, and we deeply appreciate the governor saying that he cares about all New Jerseyans, especially, including those who are incarcerated either in the criminal justice system or in the immigration system. But we need to see more action here right now. And I appreciate all of the work that New Jerseyans are doing to reach out to our government right now in this dire time of crisis. Look, looking forward, we have two options here. We can go to a society that's more polarized and more unjust, or we can go to a society that's more inclusive, takes care of its people, and creates opportunities for everybody to be a welcome and included participant. And I want to see the latter. I want to make sure that we do our part as the ACLU and other advocates to do our part to make sure that we're going to a new normal and that we don't return to the status quo, so that the next time an emergency arises, and it sure will, there will be some sort of emergency in the future, we don't see the same levels of disparities that we're seeing right now. And while we may be in unprecedented times, the injustices that we're seeing have long existed, right? The injustices that we've seen around racial lines have existed since the founding of this country. And we want to make sure that we're doing whatever we can to build the infrastructure so that we don't see those continued injustices and that we operate on a more level playing field across the board. Lastly, I just want to say that the ACLU is here. We have a COVID-19 hotline that you can check out if you go to our website at aclu-nj.org. And we're looking to not only limit the spread of the virus so that it doesn't devastate communities that are particularly vulnerable, but also respond to the injustices that are created by either overzealous or insufficient government action. We know that when government goes beyond its traditional reach, it's going to impact largely those communities that are the least privileged. And that is inextricably intertwined with race and immigration status and religion and all of those immutable characteristics that we hold so dearly. So I want to make sure that we are doing our part as the ACLU to provide a safe haven for people, to make sure that we are addressing your civil rights needs today, and hopefully we'll see a future that's a little more just. So thank you for having me, Senator and Ryan, and I look forward to the rest of this conversation.
Thanks so much, Jamal. It's so great to be a part of this conversation and to join you, Senator Booker. Folks should know that Senator Booker was the Institute's first lawyer 21 years ago when we were founded, and we're especially proud of that fact and the work that he is doing now federally. And as I think about this particular moment, I think about how we need courageous leadership from folks like Senator Booker at the federal level, but how we also are responsible in the communities where we live to push aggressively for change, because change, when it's happened, it's always happened from the ground up in our communities, often not from Washington, D.C. down. And so to Amal's point, we're especially powerful, even though we're facing some unprecedented challenges at the hands of and in the throes of the coronavirus pandemic. And as we think about the sort of the theme of the cracks in our foundation, it's clear to us during this conversation and to you all watching that this pandemic has exposed deep pre-existing cracks in our foundation. And those cracks are causing earthquakes in Black and Brown communities. In particular, these communities were already lacking the necessary resources, and they will now require more. The data in New Jersey shows that the coronavirus-related deaths of Black people are about 50% higher than our overall population of the state of New Jersey. So despite comprising just 15% of New Jersey's population, Black folks account for approximately 1 in 5 coronavirus-related deaths in the state. And that's because, as Amal shared, Black and other people of color have underlying pre-existing conditions on which this virus preys and are more likely to be frontline essential workers in jobs that expose them to the virus and are less likely to get the health care that they need. But I think what this pandemic shows us most clearly, that if there's any lesson to be learned from it, it is that structural racism itself is the pre-existing condition. That the coronavirus pandemic is only exacerbated by the underlying pre-existing condition of structural racism. New Jersey is a fascinating state. It is at once one of the most racially diverse states, but that racial diversity exists along some of the fiercest racial segregation. New Jersey is also one of the wealthiest states in the country. We are the second wealthiest state in America, but that incredible wealth exists alongside some really punishing poverty. And we're seeing that play out in real time as our most vulnerable communities of color grapple with the coronavirus pandemic. It's for that reason that we worked with a number of partners, Micheline Davis from RWJ Barnabas Health, with Elise Body, one of the board members of the Institute, and a host of others to push for the introduction and ultimate passage of coronavirus racial data. And the thinking is that, as we know, pandemics like these always cause earthquakes in communities of color where there are cracks in the pre-existing foundation. And so we've asked for, and we're blessed to get past, data that will be provided at the census tract level by race, by gender, by location, and we will see clearly the way in which coronavirus is disproportionately impacting particular communities of color. Then the challenge for us is to imagine a response that is commensurate with the harm. Meaning we have to think about, how do we address the exacerbated harm from the coronavirus pandemic, but also address the pre-existing racial disparities themselves rooted in structural racism. So for example, when this data is made available, we expect to map it and be able to identify those communities most impacted by the pandemic. And then we need to marshal public policy and legislative responses that respond to the harm. So for example, advancing Senator Booker's baby bonds initiative, but also thinking about, how do we advance a guaranteed income program, a universal basic income program in those communities made most vulnerable, not just by this most recent pandemic, but how do we fill in the pre-existing cracks to empower our communities most separated by wealth? You know, at my organization, the Institute for Social Justice, we think a lot about the racial wealth gap in New Jersey. New Jersey, as I shared, is a state of incredible wealth. It's here that the median net worth for white families is $352,000. This is the highest net worth of anyone in the country. $352,000, the median net worth for white families. But by stark and really staggering, shameful contrast, the median net worth for New Jersey's Latinx families is just $7,200. And the median net wealth for New Jersey's Black families is $6,100. A staggering racial wealth gap that existed before the coronavirus pandemic. How do you close a racial wealth gap of that magnitude? With that level of separation, we need to imagine a response that is up to the task of meeting the challenge that we face. And so we've got to be thinking about making incredibly deep investments in those communities separated from wealth, not just now, when 1 million people in New Jersey have filed for unemployment benefits. New Jersey in the last month has paid $1 billion to help those who've been separated from work. But how do we empower those communities now and before the pandemic who were separated by design from wealth? It's interesting because we have these conversations about investments, and we often hear from folks about how there's just not money available to do the kind of social justice, the kind of repair that's required in response to the kind of structural racism we see playing out in our communities, now ravaging people of color in particular. But New Jersey makes very, very deep investments, to be sure. And so I want to share a quick word to Amal's point about how New Jersey does youth justice. New Jersey is a state that in the last 20 years has reduced its overall prison population in the adult and the youth system by more than 50%. So that today in the youth justice context, there are fewer than 200 young people in prison, a significant fact which we can lift up as a way to reduce the prison population. New Jersey stands out as a leader in that respect. But even as New Jersey has reduced its overall youth prison population, racial disparities in it have exploded. So that today in New Jersey, a Black child is 21 times more likely to be in prison than a white child, even though Black and white kids commit most offenses at about the same rate. As a result, in New Jersey, a state of 9 million people, there are 8 white kids in prison. 8. And the rest are Black and brown. Now that, to be clear, is by design. New Jersey opened its first youth prison for boys, Jamesburg, just 2 years after the end of the Civil War. And since that time, thousands of kids have come and gone through its gates. Most of them have been Black and brown kids. But the reason that we see these racial disparities is not because white kids don't do things that Black and brown kids do. It's that there's a very different response when Black and brown kids do things that ensnare themselves in the criminal justice system. So part of our charge is that in this crisis moment, how do we reimagine youth justice? We worked with Amal and his team at the ACLU very successfully to encourage the Attorney General to provide data around the number of young people in the youth justice system who contracted the coronavirus. And then we urged successfully the Attorney General to provide testing for every kid in these youth facilities to ensure that they're well cared for. And then have been working aggressively with the Attorney General to send home those kids who don't pose a public safety risk. But more broadly, how do we build a youth justice system that invests fairly in our kids? New Jersey, under Governor Murphy's leadership, will spend this year $300,000 to incarcerate each kid. To be clear, to incarcerate Black and brown kids, because in New Jersey, youth incarceration is a specific investment in incarcerating Black and brown kids. How then do we think about investing differently in a way that builds kids, not youth prisons for them? And finally, we have been in an important democracy space in New Jersey. In the last 2 years, we have worked powerfully with a number of partners in this conversation and watching it to, in New Jersey, pass automatic voter registration, to pass online voter registration, and to pass a bill, a historic bill, that restored the right to vote to 83,000 people on probation and parole. This was a right denied to people on probation and parole since 1844. So thousands of New Jerseyans joined hands and said, we're going to build a New Jersey that is 1844 no more. It's been a historic time for democracy in New Jersey, but now we have to fight in this coronavirus pandemic to make those legislative changes real. In the upcoming elections, we've been encouraging the governor to ensure that voters have the chance, yes, to vote by mail if they so choose, but also to responsibly, consistent with social distancing, be able to cast their ballot in person. We know that is a preference of Black and brown voters in particular who prefer the traditional method of voting in person, often not by mail. And I want to close by lifting up a point that Senator Booker shared as he ended his remarks around this return to normal, right? There are some who have sort of wished for or hoped that we will return to normal. And I want to encourage us to reject that kind of call, because what we've learned is that normal was unacceptable for so many people of color and supportive white and other folks. We need to be creating a new normal that connects everyone to the prosperity of the Garden State, the rich prosperity, a new normal that capitalizes on the rich diversity of the state, not in a segregated way, a new normal that thinks about justice being dispensed fairly and evenly, not based on color, a new normal that builds systems that empower Black and brown and other people of color. I'll share quickly, my board member, Elise Body, talked about how too often for Black communities, we rely on the acts of heroes, the supernatural acts of heroes who step in moments of crisis to fill in the gaps caused by broken systems. And some of you all had a chance, for example, to see my wife, Charity, who is a principal of a K-8 school. There was a special that featured her and her team at Avon Avenue School. Once the superintendent, Roger Leone, encouraged the principals to provide their students with laptop computers, my wife and her team at Avon Avenue School endeavored to deliver computers to families who couldn't get to the school to pick them up. And at some point, it was clear that she was about 125 computers short of giving each kid a computer. She was able to give each family a computer, but there were some families that had multiple kids and it was difficult to share computers. And so she endeavored, along with her team, to get every kid a computer. Mike Rowe, who hosts the show, learned about her efforts and actually blessed her and her team with 125 computers, $25,000 worth of computers to help each kid get a computer at Avon Avenue School. That's a heroic act. And there are many heroes, educators, frontline workers, others, senators, who are heroically empowering and working on behalf of our communities. But the truth is, as Elise shared in the powerful piece she wrote, heroic acts and heroes are not substitute for a system, for systems that should be designed to empower our folks. And so the new normal is, yes, every community can enjoy heroic acts, but what we need to be building in our new normal are systems that connect people to the prosperity in their communities, the richness of the diversity in their communities, the health of their communities, and the justice in their communities. And I thank you, Mal, for hosting us, Senator Booker, for joining us. I look forward to the questions that follow. Thank you.
Hannah, do you have some questions for us?
Great. Yes. The first question we have is for Senator Booker. Multiple studies around the country have shown that COVID-19 death rates are disproportionately higher in communities of color. What are our elected officials, including you, doing to address these racial disparities, or what more can be done?
Well, I think Amal and Ryan just laid out a lot of things that can be done. Again, it's just painful for so many to watch us sort of view this as a crisis in this moment, when many of us know that this has been a crisis going on from the founding of our nation, these racial disparities. What is demanded is a sense of urgency to do something about it. I want to say very specifically that one of the many things that we're trying to do on the federal level right now is just to get a lot more data. I know Amal is aware of the fact that we on the federal level don't even collect the data on police-involved shootings. It's very hard to have strategies to deal with a problem if you can't pull the information and study it. And so I introduced the COVID-19 Racial and Ethnic Disparities Task Force Act, along with Senator Harris, which would create a task force to begin to research the racial disparities that emerged out of this coronavirus, the deaths, and the more of the dynamics, and really provide guidance on the best practices to decrease these alarming numbers and deal with a lot of the systemic problems. There's a number of other actions that I am glad to see a lot of my colleagues and I joining together. For example, I'm co-sponsoring a bill with Senator Warren that would require HHS to collect and report racial and demographic data on COVID-19 testing, treatment, and fatality rates. And this, again, is a welcome step forward. But there is so much more we need to be doing, much of which has been addressed. And frankly, I'm concerned about if a vaccine, or I should say when a vaccine is made available, are we going to be diligent in making sure that as we ramp up the support of that, there are many people in our state, as I think Ryan said, that can afford to stay home or are not in danger of losing their job, can telecommute. But there are many people, again, in jobs that often pay lower wages that can't stay home. And getting testing resources applied in a way that is apportioned in a way that goes directly to the people that are most in need, those frontline first responders, but also many of those people that are more economically vulnerable. All of these things should be talked about and a plan should be made to how to deal with it. And on the federal level, this is something I'm working on, fighting for, and speaking out about. You can go to the next question, Hannah.
Thank you. And just to be clear, some questions were submitted specifically for an individual, but Ryan and Amal, please feel free to jump in if you'd like.
Yeah, neither of those guys are very shy, but I'm sure they'll jump in. That makes them so effective.
Great. So the second one is for Ryan and the group. Ryan, you talked about how communities of color have been impacted disproportionately throughout this pandemic. We've seen policies like mortgage and eviction relief in New Jersey. But what should we be doing so we don't end up in the same place again next time there is a crisis?
Yeah. So thank you so much for the question. It's one that I have thought about a lot with my team at the Institute. We're in an important moment. To Senator Booker's point, these crises, as heart-wrenching as they are opportunities to confront the challenges that we see. And I've been thinking a lot about this particular moment in the context of Katrina. So folks will remember that when Hurricane Katrina struck, there were these devastating images of people on the roofs of their homes or in the Superdome, or even those who passed away in the water, drowned in the water. And there was this initial surge of compassion to respond, to repair the harm that Katrina had ravaged on New Orleans and in the lower Ninth Ward in particular. But that compassion quickly gave way to personal responsibility critique. And folks then began to ask, well, why is it that they didn't get out of harm's way, right? Why didn't they? There was something that they did that brought the harm upon themselves. Of course, they couldn't get out of harm's way, right, as we know. And that quickly gave way then to Katrina fatigue. And folks got tired of thinking about Katrina and talking about Katrina. And I think a lot about where we are in the lifespan of the coronavirus pandemic. Initially, when the first stories came out of New Rochelle, there was a compassionate response, as there should be. That's an appropriate response. We've heard in the last several weeks some critique was, so why is it that, for example, Black folks have a higher incidence of the underlying conditions on which coronavirus preys? What's that about, right? Is that because of them? And so we've been hearing some of that. And we will, as a country, soon move to the coronavirus fatigue phase. But we're not there yet. We're now sort of in the investments phase. There's a lot of requests for federal dollars to come to states. States are thinking about their budgets very differently. And to answer that question, I think we have to be pushing very, very hard on all of our electeds, our state and federal electeds, to ensure that investments are made into communities, deep investments, investments that elected officials will tell us that we can't afford. Those kinds of investments have to be made in communities made most vulnerable by the coronavirus pandemic, so that the next time a coronavirus or other pandemic hits, we fill the cracks in the foundation to fortify communities against the kind of harm we're seeing here. That can only happen with deep investments in public policy and legislative responses, but in specific financial and other investments to repair the harm, the pre-existing harm of structural racism. And so as I think a lot about the racial wealth gap in New Jersey, to Senator Booker's point, you're only going to close that by making deep investments in communities. The racial wealth gap in New Jersey, as my colleague Janae Johnson and Andrew McChristian recently laid out in a report that we authored around housing, the racial wealth gap in New Jersey was birthed in slavery. It was created there, and it was fortified in law through practices like redlining and racial covenants and GI Bill and mortgage foreclosures. And so part of the charge is to recognize the way in which the racial disparities we see today are deeply rooted in racism that flowed from slavery. And if we're really going to repair the harm, we have to make investments that are commensurate with the actual harm. And we have a really tight window in which to do that. And so I just want to lift up a last piece around this. As I mentioned, my wife is the principal of a school in Newark. The other side of her getting each of her kids a computer is that she learned, as many teachers across New Jersey have learned, that getting a computer in the hands of a kid is actually the first step. The next hurdle is, do they have internet access at home? And so we've learned in the last several weeks that at least 100,000 young people in New Jersey don't have access to internet. Earlier this week, Governor Murphy appropriately ordered that schools would be closed for the rest of the year. Unfortunately, on that same day, he vetoed a bill that would have provided internet access to those kids, so that today, 1.3 million young people logged on to do online instruction in New Jersey. But because of Governor Murphy's veto, 100,000 kids couldn't join them. And those 100,000 kids are disproportionately concentrated in New Jersey's racially segregated schools. So part of our charge is to hold our elected officials accountable. You have to hold your city council members, your state legislative members, our governor and the administration, our federally elected officials accountable to ensure that they're hearing your voice, and your voice saying we need deep investments made in communities most harmed by structural racism.
Yeah, I'll chime in on that if that's okay, Hannah. Real quick, I'll say this. First of all, as is often the case, I agree with most everything that Ryan just laid out. And I want to add to that, I hope that when it's appropriate, we do a proper, sort of post-mortem dissection of what happened here in the coronavirus era, right? Like every state should take the charge to reflect on what went right and what went wrong. And in that should be included a racial justice analysis, right? What are the systems that failed us and created more disparities? And what are the systems that succeeded? And how can we improve upon everything? What we're seeing in a lot of communities right now is that there is a police response to enforcing social distancing, right? There's a police response to making sure that people are separated, that they're wearing masks. And oftentimes that police response is not uniform across the state. It's going to be in communities of color, and the arrest rates and summonses rates are higher in those communities than they are elsewhere. And so what we want to make sure happens is that, first of all, I think everybody here would agree with me that we're not going to criminalize our way out of this pandemic. And we're not going to arrest or summons our way out of this pandemic. So I think, a lot of the police response that we're seeing is misguided to begin with. But second of all, when we do issue these sorts of emergency orders, we want to make sure that it's uniform across the state, that certain communities aren't taking it upon themselves to issue more overzealous policing mandates than other communities, because what ends up happening is that you see the stigmatization of communities of color over and over and over again, whereas you can be sure that the police response may not be the same in Short Hills or Princeton that it is in Newark or Patterson, and we want to be cognizant of that going forward and take steps to address it meaningfully.
Thank you. Hannah, can we go with the next question?
Yep. The next question is for Amal and the group. There are so many areas in which COVID-19 has worsened the civil rights landscape, especially for people whose rights were especially at risk before. In an ideal world, what policies do you think are needed to take on those underlying problems that existed before? And in our current world, which policies do you think are achievable?
So thanks for the question. I'll start, but I welcome everybody else to join. Look, I think the reality is that in the reflection that we do, in the racial justice analysis that we do as a state, that I hope the state does, we start thinking about those policy choices as well, and we start thinking about who we're incarcerating and why. Why is it that we are incarcerating this record number of people that we are as a country? Why is it that certain things are criminalized in our state? Why is it that we have immigration detention to begin with, right? Is it really increasing public safety? I think those are some key policy questions that will help reduce some of the disparities and also create a system that doesn't prioritize mass incarceration, but prioritizes rehabilitation, reentry, and successful democratic participation. Other things, include privacy protections. We're going to see, some really advanced technology being used for contact tracing in our state and in every state. And we understand that some technology is needed to do that as from a public health perspective. But it's also important that we build into those systems privacy protection so that we don't use the data that's collected for nefarious purposes or to further criminalize communities, especially communities of color. So I welcome Senator Booker or Ryan to add on to that.
Yeah, if I may, there are so many policies that that this is exposing that are just so deeply unjust. We know that ICE policies right now, which have seen really unnecessary detention. I've called for an ending of these detention facilities. We see that so many of the people we put into them, it's just a waste of taxpayer money, puts people generally at risk. We know from the end of the Obama administration that there are less expensive ways to get almost full compliance with our civil court system to give case management ways of going about this. And so there are a lot of changes to our immigration law that would make us all less vulnerable as a society, as well as not an affront to the dignity of those that are incarcerated. I've mentioned other policies that deal with American workers, and that's everything from paid leave, paid sick leave. We need stronger OSHA standards and protections. We are seeing a lot going on with just working conditions as a whole. We call people essential workers, and we now talk openly about that, but we really need to start talking about things like hazard pay and living wages and fair wages for a lot of these jobs that we now even more so know are critical to our national well-being as well as national defense. Our healthcare system is savagely broken. And, I was watching a show on PBS last night, their evening news show, just showing how employer-based healthcare systems are so deeply unfair because during economic downturns, you have so many people, and they were just documenting different examples of people, someone with Crohn's disease who has a pre-existing condition and the cost of their medicines, a family with children. I mean, given the wealthiest country on the planet, and frankly, the most money we're spending on healthcare of any other country with the worst results. This system is so broken, and it's savage shards in an economic downturn are just grinding more people into that insecurity and bankruptcy and other personal challenges. We need to make sure that a lot of the important services that governments are doing are culturally competent, being provided with information in multiple languages. I can go through a lot of things that are being exposed here. And again, it gets me back to that first point I made is it's important to know, but really what are we going to be doing to address these issues? Even just the lack of expansion of Medicaid in many states is catching millions of Americans in a far more vulnerable position. Drug pricing and the cost of our prescription drugs in this country. There are so many things that we have even more of an urgency to address now than ever before. And I feel a real sense of urgency, and I hope that you share that as well. But unless Ryan wants to comment, we'll keep getting through these questions. Hannah, I know we're running short on time.
So I would just pick up briefly on your point, Senator Booker, and to the question around what sort of policies we can advance around the criminal justice, youth justice work. You know, what New Jersey is doing something right in the youth justice system. And that's reflected in the fact that there are 8 white kids in prison. That number doesn't reflect actual participation in crime of white kids. What it reflects is a really compassionate response from the system that is advanced towards white kids. And so one way this plays out is that, you know, every police station has the ability to do what's called a station house adjustment. So a kid gets arrested, is brought to if the kid makes it to the precinct, a decision can be made to say to the kid, listen, don't do this again, or this will happen. In the meantime, go home with a stern warning. And we've studied this, the ACLU's looked closely at this. We've seen the way in which station house adjustments are applied very unevenly from county to county. But if you back up and you look at the way in which over-policing happens in our schools, right? There's a precursor to the station house adjustment policy. And so part of what New Jersey just has to do is marshal the same kind of compassion that we afford white kids to reach Black and brown kids who comprise an overwhelming majority of those in prison. And the final thing I'll say, I lifted it up, but it bears repeating, is investing. You know, we can't be in a place where we say we can't afford to provide internet to 100,000 kids who don't have it when they're expected to do learning at home online. Or we can't say we can't afford to provide internet for those kids, but then invest $300,000 to incarcerate each kid each year. Like, the reason why you have these racial disparities in youth prisons is because we make such deep investments in incarcerating Black and brown kids. Suppose, if you will, imagine if you made an investment of $300,000 on the front end in a kid's life. What would the outcomes be, right? And so we just have to flip the way in which we've done justice, or where we've administered justice as it relates to Black and brown kids, marshaling the same kind of systems we've created for our white kids. The racialized system we've created has to be dismantled and reconfigured so that the justice system is actually justice for every kid who encounters it.
Ryan, I mean, you're preaching gospel, man. If we were not socially distanced, I'd pass the collection plate over there. You get me fired up because we have the money. The society has the money. We're paying so much more for these problems on the back end. Right. Like, take maternal mortality. It would be cheaper to give every low-income woman in America doula care than to pay the cost we are paying as a society for incredibly high rates of birth complications, maternal mortality, infant mortality. And so when you said that, you just triggered a memory in me when I was coming up in Newark politics, where we had this great woman, and I'm blanking on her name, but she was doing a presentation of a map of Newark and looking at different census tracts with how much money we spend on corrections per family in those census tracts. It was stunning to me that we were spending that money. So when you give that, and then the other thing is just it gets me is because, and I know Amal knows this as well, a lot of these issues other countries do.
Right.
You know, we're just out of line. Like, no other country incarcerates its people like this. I mean, I was talking to a Republican in the Senate about how insane it is to have some 65-year-old who was convicted of murder as a teenager, still incarcerated, and now medically vulnerable. So now they're in a prison, medically vulnerable, costing taxpayers so much money. But in other countries, the thought of more than 25 years first of all, we still, the age at which we try children for crimes is ridiculous here compared to other places. And it all costs us more money. And then the last thing I'll say, and by the way, Ryan, you're like the smartest guy I know for mentioning your wife's name like 3-4 times. You just want to make sure, for the record, you have praised your wife. I know it's Mother's Day coming up in 2 days, man. Oh.
Hello, my favorite senator.
Hello.
We'll never forget that you came and spoke to my 8th grade children 20 years ago.
Yes.
And then they voted for you. So.
well, now I know why Ryan has the luckiest man in Newark, married up, and he knows how to continue to compliment his wife. But listen, one thing that she knows intimately is this ridiculousness of just the cost of rent in America, and the housing insecurity, and how that affects kids in school. So if you are a kid in Newark, pick your city. It doesn't have to be Newark. We can talk Detroit, Chicago. You're in an environmentally unjust environment. The air quality here, the ASA rates are 3-4 times higher. More likely you live close to a Superfund site. We have 2 in our area: higher rates of birth control, of birth defects, higher rates of autism. So you have all these environmental toxins around you. Your housing stock is unstable often, and your access to housing is unstable. Remember, the mortgage interest deduction, I'll defend that, but it goes overwhelmingly to people making over 6 figures. We don't have a rental. My policy vision is that anybody who's paying over 1/3 of their income on rent should get a refundable tax credit between the 1/3 of their income and the area median income. It would take 9 million families out of poverty. And we know when a kid goes homeless, and just by giving every person in housing court access to a lawyer, it would lower eviction rates, depending on the study, 70, 90%. So if a kid is evicted from school, is evicted from their housing, their performance at school goes down. So much of this is just, we live in a community where people work full-time jobs, but are always on the economic margins. One accident, one tire bursting away from falling into deep debt, or worse, missing a payment for something that's critical. And so these are policies we could have, the kind of policies we see in other countries, to give everybody a much better floor, as opposed to making it so much harder for our children to succeed in life because of environmental injustice. More likely they're going to be picked up by the police. And the last thing, because I'm talking too much, but the last thing I want to say is, like, I lived that reality. I watched my friends growing up do things that gets kids in community. I grew up in a relatively affluent area compared to here. Watch kids get in trouble for breaking the law, get that station house adjustment, no records, they're going on. It just doesn't happen equally. It's not an equal application of justice. So I'm sorry, man. You got me all fired up, and then I'm my significant other is 3,000 miles away. You bragged to me that you've got yours right there in the house. So
I just in the next room on a conference call, but I can't.
Both of you guys want. Yeah. Come on, man. That's not the time that you brag like that to a poor guy like me isolated here. Go ahead. Hannah, do you have another question?
Senator, we are actually over our allotted time. So if you had any concluding remarks.
I would love the two fellas who just put a lot of wisdom on the table. Why don't I'll cede my time, as they do in Washington, to the 2 gentlemen to give closing statements, and then we'll wrap.
Sure. I'm sorry, I cut out for a second. Did you call to me?
Yes.
Well, look, I want to, just for closing remarks here, I want to share with you, the future vision that I have. I think we can decide to have a future that is more equitable. I think we could decide to have a future that's more hopeful, a future that creates opportunities for all people, regardless of their identity. Like Ryan and like the senator said, we can't go back to normal, right? This conversation about reopening and restarting, that's status quo talk. What we need to do is make sure that we are not going back to the status quo. We're creating up systems and building up systems that allow for people to treat each other more equitably, and that the systems actually take advantage of investments that are available. Like the senator said, we're not low on money here in this country. We can make those investments on the front end. We shouldn't be incarcerating people unnecessarily. We shouldn't be taking steps to over criminalize folks across the state or across the country. And look, right now we're in a position where every level of government, county, local, state, federal, is creating policy that is implicating civil liberties and civil rights. And there's an opportunity in that, right? Like, we can do policies that create opportunities for justice or don't. And I think it requires an awareness of from our leaders that allows for the most just route. So I encourage everybody that's listening to talk to their lawmakers, talk to their governor, talk to anybody that'll listen about the vision that you want to see for our state and for our country.
I would just say I really appreciate the chance to have this conversation. So good to see you, Senator Booker, and talk to you, Amal. My colleague, Retha Onatiri, who leads our youth justice work, and our dear partner, Reverend Charles Boyer, have for the last year been having conversations with communities of color across New Jersey, thinking about sort of what the challenges are in those communities and what the opportunities are to confront them. And so they've just been asking people in their communities, what resources would you need to both confront the reality that we face, which is rooted in structural racism, but how would we confront those with public policy and legislative decisions? And then, to your point, Senator Booker, what kinds of deep investments should we be making? So I'm really, although I recognize how humbling the situation is and the challenges that we now face, I'm also inspired by the work that's being done in communities across New Jersey, working from the ground up, really to fashion solutions to these challenges, because the power, to your point, Amal, is in our communities. And so it's on us to organize around it, to harness it, and to ensure that we're taken seriously by elected officials at all levels. And then importantly, to ensure that investments are made, not just in a crisis moment, because I do think the danger here is to respond to the coronavirus pandemic and then call it good, right? To check that off. But we've had to build a community, build a society that fills in the cracks in our foundation so that we're fortified against future crises, because they will come, and we can do that.
Thank you, everybody. I ceded my closing remarks, so I'm only going to say, please fill out your census. That is something that's really critical for us to be able to have the kind of political power and resources to help fuel this change. And please make sure that you understand that if it is to be, it is up to me, those 10 two-letter words. We all have to be activists in this. And I'm grateful to Amal and Ryan. They are two guys that have been partners of mine, have rightfully challenged me, and are really visionaries for what the future can be like. And I'm grateful to have them and be working with them here in the state. And Hannah, thank you for trying to keep some semblance of order to us as we went through this evening. So thank you.
Thank you. Take care.
Thank you, guys. Bye-bye now.